Hello, my name is Dr. Paul Scheiwiller. I'm an anesthesiologist here at the Institute of Orthopedic Surgery. I want to talk to you about a femoral nerve block that your surgeon has ordered to help manage your postoperative pain. Before we get started, I want to introduce some of the members of the team that you'll be meeting. The first, you may have already met, is an SBA. An SBA is a specially trained assistant who will be assisting me with positioning, prepping, and actually assisting in the procedure. She will also monitor you before, during, and after the block, and she'll help provide for your comfort. You'll shortly be meeting an anesthesia provider. This will be the person that'll take you back to the room, get you off to sleep, monitoring you very carefully. She'll be waking you up, taking you to our recovery room. These procedures have been designed with your comfort and safety. The nerves to the knee are located in the upper thigh groin area and are approached in either of the two places indicated by the area. This is a very simple procedure. It will take less than 5 minutes to complete, and the block will generally last 12 to 24 hours. You will be positioned on your back for this procedure. The area will be prepped. An ultrasound probe will be placed over the nerves. The ultrasound machine allows me to see underneath your skin and actually see your nerves. This is extremely helpful. Then we numb up your skin with a very small numbing needle, which is generally about the size that an insulin-dependent diabetic would give themselves an injection with. Then I take another needle that is placed through the numb skin and is directed to the proper location. This is all done under ultrasonic guidance. Medication is injected. We watch it surround the nerves. Your leg muscles may twitch to further ascertain the proper position. We will tell you ahead of time what to expect. Once this procedure is completed, we remove the needle and we're done. The area of the block is the areas in the orange and purple. The blocked nerves do not go to these other areas. You may have pain in unblocked areas, specifically the sides of your knee or the back of your knee. Pain medication will be provided if you have pain in unblocked areas. Shortly after this procedure is completed, you may notice warmth and notice that your thigh is feeling extremely heavy. This is a temporary effect. It lasts 12 to 24 hours. Your lower extremity will not go numb, and you will not notice numbness in your foot. The side effects last, again, 12 to 24 hours, and it can be characterized, again, with extreme heaviness and weakness of your thigh. Use extreme caution with your ambulation. Again, we can't stress this enough. Be very careful with your leg. Use extreme caution when you get up. If you are in the hospital, make sure you call your nurse before you get up and make sure that you wait for them, especially in the bathroom. Use assistive devices as prescribed. If you're going home, make sure you have a clear, safe path between your bed and your bathroom and the television, etc. Wear your brace as directed. The benefits of the block extend into the operating room. They include less anesthesia and pain medication during the operation. Generally, you'll wake up quicker with less nausea and vomiting. You'll be able to leave the recovery room and the recovery area faster, and you'll have significantly less pain postoperatively during the duration of your block. You will receive a prescription for pain medication. Start your pain medications prior to the block resolving. You will receive specific recommendations at discharge. Anytime we place a needle in anybody for any reason at all, there is a small amount of risk. These include damage to surrounding structures, veins, arteries, nerves, a risk of medication reaction, infection. This is why we use an ultrasound machine, special needles, injection techniques, and we monitor you during and after the procedure. A few housekeeping items. Your guests will be asked to exit. We'll be bringing in our equipment, which include the ultrasound machine and several trays of materials. You will be hooked up to monitors, EKG, finger clip, and blood pressure cuff. We understand if you're nervous. It's perfectly normal. We're going to take great care of you. The nurse will generally provide you with a light dose of sedation, which is roughly equal to 2 drinks or 2 Bud Lights. This is given before your procedure through established IVs. There'll be time for questions if you have any. Please don't hesitate to ask. That's what I'm here for. I'm looking forward to meeting with you, and thank you for your attention.